This is the interim results from the combined phase 1 and phase 2 study of our ex vivo lentiviral gene therapy for Fabry's disease. Just always reminding you that all the data is investigational and it hasn't yet been approved by any regulatory agency, and its safety and efficacy have not yet been established. A sophisticated audience like this is well familiar with the ex vivo stem cell procedure, and also for those who have cared for Fabry's disease, we're very familiar with the fact that ERT has been a great boon, but also leaves a significant burden of logistic demands and unmet need for ongoing symptoms. So it's an improvement, but not a cure. The two studies that we presented were in total have 14 patients dosed through this therapy. There were 5 done in Canada as part of the phase 1 study, where those patients were already on enzyme therapy. And in the phase 2 study, we've now treated 9, but that's been very quick and recent, and includes patients referred from Brazil, where they don't have ready access to enzyme therapy. And because it's quite recent, we'll only present the safety data on 8 of those 9. And of the first 3, we were using busulfan as our conditioning agent. The first 3 were melphalan, and then the last 6 were busulfan, using a targeted concentration intervention. And overall, the safety of the investigational product is amazingly reassuring. There have been no adverse events or serious adverse events. There's been no significant allergy development. And so all the side effects are really centred around the conditioning regimen. And this was both in Canada, where they were all treated with melphalan, and in the phase 2 study in Australia. And anyone who's worked in a haematology unit knows that you've got your allogeneic stem cells and your autologous stem cells, and the autologous ones are a walk in the park for a haematology unit in terms of being short, brief, and very manageable. And so the actual severity of grade 3 and 4 weren't much over 15-16% of the predictable A and E's, and this was all based around the predictable cytopenias, the drop in white cells, platelets, neutrophils, and red cells. And in general, they were all over within a week for most patients. With busulfan, the mucositis persisted perhaps a little longer, and the advantage of giving slightly greater marrow suppression is you create a greater niche for the transduced stem cells to be infiltrated and then recover. On the other common adverse events, abdominal pain, diarrhea, nausea, vomiting, lymphopenias, none of them actually reached a grade 4 severity. So overall, all the adverse events were just consistent with the conditioning, predominantly grade 1 or grade 2. None were related to the investigational product, and because it was reasonably predictable and transient, it's certainly a rationale for proceeding on with the investigational program, which we're very proud to be participate, and take our hats off to the multiple team members that are all part of this, but even more so to the patients that are willing to go on this journey together.